Good morning, I'm Vic Senese and welcome to UroNurse News. Today I bring you a vital story about cancer survivorship and sexual health, topics often overlooked in oncology care. A recent study presented at the ESMO Congress in 2025 sheds light on how proactive, nurse-led discussions about sexuality can profoundly enhance quality of life for women recovering from gynecologic cancers. Dr. Jessie Tecli Desir, a nurse scientist from Homestead, Florida, conducted interviews with 15 women aged 31 to 70, all of whom completed gynecologic cancer treatment. These women had undergone surgery, chemotherapy, radiation, or precision therapy, representing a diverse mix of racial, educational, and spiritual backgrounds. Diverse. The study explored 4 existential dimensions of recovery: corporeality, temporal reality, spatiality, and relationality. Essentially, how these women experience their bodies, their sense of time, space, and relationships after cancer. Now, 5 major themes emerged: hopelessness, pain after treatment, losing oneself of sense of sexuality, lacking conversation, and survivorship. Many participants reported emotional and spiritual distress. Changes in their body image, scarring, and pain created feelings of asexuality or disconnection from femininity. Some mourned the loss of spontaneity and intimacy in their relationships. Others described fear of rejection or shame. A pervasive theme was the absence of dialogue. Nobody was talking to them about this. Nearly all participants said their care teams never initiated conversations about sexual health. Some were dismissed because of assumptions about their age or marital status. This silence left many navigating identity loss and emotional trauma alone. Yet, amid these challenges, the theme of survivorship emerged as a story of resilience. Many women reclaimed their sexuality through communication with partners, spiritual practices, or reframing body image. Survivorship, they said, goes way beyond remission. It means reconnecting with oneself and others. Dr. Desir stresses that oncology nurses are uniquely positioned to bridge this gap, integrating sexual health into routine assessments and survivorship care. Planning is essential to restore intimacy, self-worth, and overall quality of life. This study highlighted the profound psychosocial impact of gynecologic cancer on women's sexuality and identity, said Dr. Desir. Findings that support the need for holistic, culturally sensitive survivorship care, where oncology nurses proactively address and assess sexual health. For cancer survivors, this research underscores an important message. Your recovery isn't just about remission. It's about reclaiming your body, your intimacy, and your sense of self. Join me tomorrow as I separate flossing facts from myths and reveal why this simple habit could save your teeth and gums. Don't miss tips, tricks, and the science behind keeping your smile healthy. Tonight on Dr. Jeff Talks About Sex and Intimacy, Dr. Jeff sits down with renowned somatic psychotherapist Holly Richmonds to explore how survivors can reclaim pleasure and sexuality after trauma or cancer, like we just talked about. Drawing from her book, Reclaiming Pleasure, Dr. Richmonds shares a compassionate, empowering roadmap for healing, rooted in agency, embodiment, and hope. Whether you're a survivor, partner, or clinician, this episode offers insight to reconnect with your sensual self safely and courageously. Don't miss this deeply affirming conversation on resilience, connection, and the joy of reclaiming your sexuality. That'll be tonight, 7 p.m. at drjeffsextalk.com. As you can see, I got the thing right there. You know, it kind of runs home. You know, if you haven't gone to listen to any of these episodes from Dr. Jeff Sex Talk, I highly encourage you to look it up, because we're trying to get that connection for patients that are not finding the health care that they need. This is a way to find out where you can find resources, who you can talk to, so you're not quite alone. You know, we're trying to get rid of that major thing that this study just showed. So check it out. For more updates, don't forget to like and subscribe.
A updates on clinics, tips that are new, stories of nurses and breakthroughs.